At Springfield Hospital in Delaware County, the Da Vinci robotic surgical system is just another instrument that surgeons are using in the operating room. In fact, hospital surgeons have successfully used the state-of-the-art Da Vinci robot to perform hundreds of minimally invasive surgeries for both men and women, while encountering occasional skepticism and curiosity.
When I tell patients that we're going to use a robot for their surgery, they often look at me and say, "How does that work?" And I explain to them that I'm still their surgeon, still doing the operation, but the robot is an instrument which I control through the console here. So all the movements I make are translated to the robot and then to the patient.
I have to say I was a little bit of a skeptic initially. As a surgeon, there's nothing like using your own hands, your own fingers, being able to actually hold the organ, in my case, holding the kidney. You have full control. So I have to say I was a little bit of a skeptic of using robotics with regards to kidney surgery. Kidneys like to bleed, and when it bleeds, really grab the kidney, you stop the bleeding. And I was worried that, well, I wouldn't be able to do that robotically. I have to say, though, I've become a believer. My hands are connected to the joysticks right here, and when I operate, the motion of my hands is directly transmitted onto the robotic arms, and the robot replicates the motion of the hands.
The Da Vinci robot utilizes a powerful 3D camera technology that helps the surgeon to see images much more clearly.
There is a right and a left component which allows the surgeon to see in a three-dimensional field rather than two. So he has significant depth perception.
This unit just allows us to get into the different parts of the abdomen and pelvis through tiny, tiny incisions that people can much easier to hold.
The setup for the surgeon is much more ergonomic and user-friendly. Compared to conventional laparoscopic techniques or even traditional open surgery, which requires a lot of repositioning of the surgeon, torquing and twisting of the body, at the console here I can maintain a relatively normal position, don't have to torque my body in any way, and so that leads to much less fatigue for me, which is much better obviously for the patient.
Offering less pain and faster recovery times has also helped to make the Da Vinci robotic system popular with the hospital nursing staff as well as with patients.
What really appealed to the nurses was the idea that the patients didn't have as many postoperative complications. We didn't see the patients having a large blood loss, and these are all very big surgeries. We saw that the patients were having less problems with pain, and they were recovering and being discharged from the hospital in 24 to 48 hours.
I realized that surgery could be done using the Da Vinci robot. I was just excited. And the reason for that is the alternative would have been major surgery involving opening my abdomen. This way it was minimally invasive.
Since acquiring the Da Vinci robot in 2006, Hospital President Gwen Smith says it has been an important advancement for the hospital, the community, and patients.
It has given a new branding and awareness to our community now. They see us not as the little hospital that can't do anything but maybe just nips and bumps and maybe just small surgeries. They can see now that we can do large surgeries with great outcomes. We talk about costs, but we also talk about every day a patient stays on in the hospital adds more costs to our bottom line as well as to the insurance companies. And we're working in a health reform environment right now where we need to give the best care and do it most efficiently and effectively. And for that purpose, the robotic surgery has done that.